Good morning, I'm Ann Good. I'm the Henry County Health Commissioner, and I'd like to thank you for coming out and risking your lives to cover this zombie apocalypse. As of 9:25 this morning, the Health Department has dispensed 25 doses of medication to prevent zombie fever. Zombie fever is an infectious disease, and there are reported 20 cases of zombie fever in Henry County. Law enforcement are working diligently to round up the deadly creatures and to prevent a future spread of zombie-wide pestis. Zombie fever occurs when Y. pestis infects the lungs and slowly turns people into zombies. This type of bacterium can spread from person to person through the air. Zombie fever is also spread by breathing in Y. pestis that's suspended in respiratory droplets from a zombie or someone infected with the zombie fever. Henry County Health Department would recommend that every resident take precautions not to come in contact with any zombie and to come to Holgate School to receive the medication to prevent the disease. Anyone presenting with the following symptoms should seek medical care from the local healthcare facility: fever, headache, open sores, decaying skin, chest pain, cough, a hunger for brains, or slowly developing zombie-like qualities. These symptoms progress over 2 to 4 days and can cause respiratory failure, shock, and a craving for brains. Without early treatment, persons may die and become a zombie. Persons without these types of symptoms should come to Holgate local schools to receive the medication to prevent the zombie fever. To reduce the chance of death and zombie-like qualities, the candy must be given within 24 hours of the first symptom or prior to symptoms starting. M&Ms and Skittles are the only known prevention and treatment for zombie fever. Candy treatment for 10 days will protect people who have had direct close contact with infected persons. Currently, the Strategic National Stockpile has supplied enough candy to prevent zombie fever for the population of Henry County's 28,000 residents. It is vitally important that each and every person in Henry County start the medication immediately to prevent any more of the deadly zombies being created. The Health Department will be staffing this point of dispensing site location here at Holgate Local Schools for the next 24 hours to dispense the medication. We will be providing further directions available in the coming days to instruct you on the remainder of the treatment process because it is a multi-day treatment. I'd be happy to take any questions that you may have.
What kind of staff do you have on hand to distribute this medication?
We have 60 Health Department staff as well as about 10 volunteers from our Medical Reserve Corps that are staffing our point of dispensing site here.
About how many residents do you expect to treat in Henry County?
I would hope over the 24-hour period that all 28,000 that may not have symptoms, those that do not have symptoms, that we'll treat here in that time period. Not all need to report though. A family member has the ability to pick up for all the other family members. So we won't expect a whole 28,000 people to show up here.
That was my next question. How do you expect people who can't get here to get the vaccine medication? How do you plan on handling them, and how do you know that they've taken the medication to make sure that everyone's been medicated properly?
We also have arrangements made with some facilities where the residents can't get out. Those are closed point of dispensing site locations where we provide medication to them and they treat their residents and their staff. So we are able to take care of some residents that way. Otherwise, we urge people to contact family members and friends that they know are not able to travel easily and to get the necessary information to be able to get their medications here and then take it back to them.
You said there's been about 20 cases so far. How are those victims being quarantined and handled?
They're currently receiving treatment at our local healthcare facility, our hospital.
And they're sectioned off from the rest of the hospital as well?
Right, they're taking proper precautions there.
What would you say to the public? What's the best thing the public can do besides coming down here to get the medication in handling the situation?
It's important not to panic. While this can be spread easily, it also could be prevented easily. So the first step is coming to get the medication or sending a family member to get the medication and then actually taking the medication as we prescribe, and then avoiding contact with individuals who have symptoms, and if symptoms develop, to go directly to the hospital to receive treatment.
Guess the last question, can you describe what the situation, the zombie situation is like out there? I mean, what can people expect to see if they come in contact with a zombie?
Well, really, it goes along with the symptoms that we've described. So the zombies may have open sores or decaying skin, a cough, a hunger for brains, and other zombie-like qualities that most people are familiar with through the TV shows that feature zombies.
Is there a way that they can defend themselves that you could recommend? Is there a survival kit that you recommend?
We recommend just not having exposure, and if they've received exposure, to get the medication or to report to the hospital if they have symptoms.